India's capital has been locked down amid a staggering increase in the number of COVID infections. More than a dozen states have imposed new restrictions, including curfews and lockdowns, as the country reports more than 200,000 new cases for the sixth straight day. Here's CNN's Vedika Sood with details.
Bodies piling up in crematoriums, graveyards running out of space. Hospitals filled to a breaking point. Some patients left with no choice but to share a bed. Dozens are being treated in ambulances. India, known as a powerhouse for vaccines, some states say they're running low on supplies. India's healthcare system is collapsing under the crush of COVID-19. Dr. Jalil Parkar is a frontline worker in a top Mumbai hospital that had to convert its lift lobby into an additional COVID-19 ward. Parkar says there's an overwhelming increase in cases and patients.
The volume is humongous. It's just like a tsunami, or you can say worse than a tsunami.
Thousands have taken to social media desperately looking for beds, oxygen supplies and medicines, all of which are running out. Ignoring the alarming surge, millions attended the Kumbh Mela festival, one of the largest festivals in the world. Despite strict guidelines and a truncated schedule, thousands of devotees have tested positive in India's northern city, Haridwar.
On the one hand, we are struggling to increase beds, increase oxygen supplies, increase drug supplies to those who need them to save lives. On the other hand, we have gatherings all across.
Festival patrons are finally moving out after a belated appeal by Indian Prime Minister Narendra Modi. Even after surpassing 200,000 new daily cases, Modi and politicians across party lines have been sending a mixed message by campaigning for state elections with thousands in attendance. People queuing up to vote, flouting basic safety guidelines. Migrant workers are fleeing big cities after local governments announce partial lockdowns.
Everything is shut. How do we earn to survive? We'll come back once things are better.
This deadly second wave has India facing a health emergency like never before. Many are asking, did India let down its guard? And so many people are angry because of this, John. They've taken to social media. They're questioning the government. They're questioning the Prime Minister. There are these desperate appeals for help, like we mentioned. This is the sixth consecutive day that India has recorded over 200 million new daily cases of COVID-19. And today we have more than 1,761 deaths. This is the highest in the last 10 months. Crematoriums are full. Graveyards have no more space in some cities. It's a very grim situation. And at this point in time, the Indian government has now announced that those 18 and above will be eligible to be vaccinated from the 1st of May, which means in a couple of weeks from now. Even the national capital and its region has been locked down for the next 1 week because the Chief Minister of Delhi has said we've already reached our capacity when it comes to the public healthcare system. They are buckling under pressure, and the only way out was to now implement a lockdown for the next 1 week, and because of which you have a lot of migrant workers also fleeing from Delhi to their homes because they're so worried that they won't have work to do and they'll be stuck in Delhi. That's the situation. On a personal note, before I do log off, John, let me also tell you, I'm one of the people who's reached out on social media for help for a relative because beds are running out, you have oxygen supply running out, remdesivir running out, and very few plasma donors because that option has been exhausted in Delhi already, John.
Vedika, wish you luck. Thank you. Vedika Sood there in New Delhi. Appreciate it.